New numbers today from the World Health Organization suggest Ebola could eventually infect as many as 20,000 people in West Africa. It comes a day after the WHO recalled a medical team working in a mobile Ebola lab in Sierra Leone after an epidemiologist working in the lab tested positive for the disease. Joining us this morning from our downtown studio is Dr. Pakes. He is an assistant professor at the University of Toronto's Dalla Lana School of Public Health. Good to have you with us on this.
Good morning.
Tell us specifically about this situation first, this person working in this lab and how this could have come to be.
Well, there's the WHO lab in Calhoun in an area of Sierra Leone. There are lab workers there, there are epidemiologists there, and somehow this individual from Senegal got infected with Ebola, and that just means that there's some kind of problem with the protocols, the biosafety in the lab overall, and that's the reason that it was shut down, in order to ensure that this kind of thing doesn't happen again, to clean out the lab, to make sure all of the policies and procedures are up to snuff for the very serious disease that it is.
The WHO says it has a team standing by to go in after this assessment is done, but how serious is this when something like this concerning biocontainment happens?
Obviously, it's very serious. The ways Ebola are transmitted are really through direct contact, through funeral practices in healthcare workers directly caring for patients, and then through possibly lab workers who get infected by taking samples and testing them. So it's something very serious. It's something that healthcare workers obviously are very concerned about, and that organizations who are sending help to Sierra Leone, Liberia, and other places in West Africa are very concerned about.
What does this mean, doctor, for locals who are still needing to get treatment? What happens to them?
Well, a very significant element in treatment, obviously, is figuring out who has the disease and who doesn't, and the labs are the only ones who can do that, and the labs that can detect and test for Ebola really need a very high level of biosecurity, and without those physical lab facilities and without the people to staff them, people aren't going to get the appropriate treatment. But more importantly than that, I think people aren't going to know who has the disease and who doesn't, and the bigger picture in terms of containment is going to be compromised.
Wow, and already, I mean, the news this morning from WHO saying that the Ebola outbreak in Africa could infect some 20,000 more people. This is 6 times what medical people, what doctors currently knew about or thought that they were dealing with. This is huge.
Well, it's really a situation that we haven't dealt with, we being the global infectious disease and public health community. Ebola is a disease, as I said, that is transmitted really by direct contact, and there is a feeling, continues to be a feeling that, you know, it's somewhat difficult to spread, and yet we see it spread quite quickly right now in West Africa. We've never seen this before, and we don't know what to expect. We just know we have to work as hard as we can in order to prevent any further spread.
Is it about supportive care at this point?
For the individuals who are affected, there's supportive care, there's hydration, there's really making sure that there are proper containment procedures in place in the hospitals in order to protect healthcare workers. But I think a really important element there is to let people know that there are facilities available for them if they have the disease, so they're really open and forthcoming in saying that in coming to healthcare facilities to say that they have the disease, so that contact tracing can be done and further spread can be mitigated. And when those supportive facilities aren't available, as they aren't now, in fact the MSF has just said that it's very clear that those kind of facilities are inadequate, as well as the lab facilities being inadequate right now, it is only going to spread, which is what's concerning everyone.
And MSF, Médecins Sans Frontières, Doctors Without Borders, is who you're referring to. Doctor, thank you so much for this.
Thank you.